Hello, I'm Mary Beth Farrell, and this is my pretend dissertation defense for Aspen University's Introduction to the Dissertation course. For this presentation, I will be reviewing the introduction, methods, results, and conclusions of a previously published dissertation, but pretending it was my own and feeling kind of silly while doing it. The original work was completed by H.M. Jaber in 2014. So let's begin. The title of my dissertation is The Impact of Accreditation on Quality of Care, Perception of Nurses in Saudi Arabia. My goal in performing the study was to assess nurses' perceptions of the impact of Joint Commission International Accreditation on quality of healthcare. I also attempted to explore contributing factors affecting perceptions of the quality of care. Hospital accreditation is seen as a mechanism to improve quality. The accreditation process evaluates an organization's adherence to predefined standards. The Joint Commission International has been accrediting healthcare facilities worldwide since 1994, and accreditation is expanding globally. Accreditation is only recently launched in Saudi Arabia, and there is keen interest in the benefits. However, the accreditation process is time-consuming and expensive. In countries where resources are limited, healthcare organizations must be cautious when deciding whether to invest in accreditation. At issue is the limited data supporting accreditation's effectiveness in improving quality. There are few published studies on the impact of accreditation across the globe. Particular to Saudi Arabia, there are only 2 published studies examining accreditation. Because there is limited research regarding the impact of accreditation on quality, the perceptions of those involved in the accreditation process are valuable. The purpose of this study was to evaluate workers' perceptions of the effect of Joint Commission International Accreditation on quality in Saudi Arabia. The specific objectives were to assess nurses' perceptions of accreditation, to describe accreditation factors that could affect quality of care, and to identify demographic variables that might explain differences in perceptions. There were 3 research questions. The first question is, what are nurses' perceptions of the impact of Joint Commission International Accreditation on quality of care? Second, what is the relationship between quality improvement activities and nurses' perceptions of quality? And 3, what was the impact of demographic variables related to perceptions of quality in accredited and non-accredited facilities? To assess these perceptions, I surveyed Saudi Arabian nurses working in accredited and non-accredited hospitals. Saudi Arabian nurses' beliefs about accreditations were unknown before this survey. I will now move on to discuss the methods section of my dissertation. As stated, the goal of my research was to determine Saudi Arabian nurses' perception of the Joint Commission International Accreditation's impact on the quality of care at accredited and non-accredited hospitals. I further aim to explore and predict factors contributing to nurses' accreditation perceptions. To answer the research question, I surveyed nurses in accredited and non-accredited hospitals. I utilized a cross-sectional research design and collected quantitative data via a previously validated instrument. I hypothesized nurses working at accredited hospitals would be more likely to perceive the accreditation process as beneficial in improving the quality of care. I also hypothesized a significant effect of nurse characteristics such as age, gender, experience on quality of care perceptions. Looking at nurse characteristics allowed me to identify predictors or confounders related to the dependent variable. The dependent variable in the study was nurses' perceptions of quality. The independent variables were accreditation, leadership, commitment and support, strategic quality planning, human resources utilization, quality management, and use of data. The research was conducted using 2 similar hospitals in the Kingdom of Saudi Arabia where I live. The primary difference between the 2 hospitals is that one was accredited and the other was not. I am the Director of Education at the accredited facility. Nurses were targeted as opposed to other staff types such as physicians or allied healthcare personnel because nurses work directly with patients and are in the best position to assess the quality of care. Approximately 1,000 nurses met the inclusion criteria. A minimum sample size of 120 participants was calculated. However, to avoid a low response rate, I utilized purposive sampling, non-probability, and convenience sampling, and distributed the survey to as many nurses as possible. To recruit participants, I created a survey packet and personally passed out packets to eligible nurses working in the nursing units on multiple occasions. The packets contained an introductory letter, an informed consent explanation, the survey, and a return envelope. To learn about nurses' perceptions of accreditation's impact on quality of care, I used a self-administered questionnaire. The survey consisted of 2 parts. The first part included questions related to quality improvement activities and the effects on quality. Participants were asked to indicate their level of agreement using a 5-point Likert scale. The second part of the survey contained demographic questions such as age, gender, degree, and position. The survey was designed and validated as part of the Malcolm Baldrige quality model. I physically recruited participants by visiting numerous nursing floors during various shifts to distribute packets containing an invitation letter, paper questionnaire, informed consent, and a return envelope. The survey responses were collected anonymously. Within the packets was an information on informed consent, and the return of the survey in the provided envelope implied voluntary consent. I used SAS version 9.4 to analyze the data. Participant demographic data and responses were reported using descriptive statistics, including the number and percentage. To compare differences in nurses' perceptions between the accredited and non-accredited hospital, I analyzed the data using Wilcoxon rank sum test. I also performed correlation analysis to find associations between the independent variables and the dependent variable. Finally, I used regression analyses to identify predictors of quality of care. A p-value less than 0.05 was considered significant. The study was limited by the small number of hospitals surveyed, which restricts the generalizability of the results. The study also was limited because only the nurses' perceptions were considered. I did not include other hospital personnel such as physicians or pharmacists. Also, I did not consider patient perceptions and health outcomes. Therefore, the effects of accreditation on these variables cannot be assumed. Finally, my use of a closed-ended survey might have affected the response reliability by limiting responses to structured questions and answer choices. I obtained investigational review board approval from Walden University and also obtained written permission to conduct the survey from the administration at both hospitals. To limit participant reactive bias, in the letter of introduction, I explained participation in the survey would have no bearing on the nurse's work situation. I further attempted to limit bias by assuming the results would only be reported in aggregate and completed surveys would be kept in a secure location and destroyed following study completion. Moving on to the results section. I distributed 583 questionnaires between both the accredited and non-accredited hospitals. This comprised 60% of the eligible nursing population. 383 questionnaires, which equates to a 66% response rate, were returned. This response rate was well above this response rate well exceeded the 128 required minimum for statistical power. All return surveys were checked for completeness. The responses were coded and entered into the SAS software. A random sample of data was checked at each step for accuracy of data entry. The demographic data is shown in the table. 96% of the respondents were women at the accredited hospital and 82% at the non-accredited hospital. Most were younger than 30 years old. Interestingly, 81% of the nurses were Filipino and had worked at the hospital between 2 and 5 years. Most nurses held a bachelor's degree and held staff nursing positions. Research question 1 was, what is the impact of Joint Commission International accreditation on quality of care ratings by nurses? Comparing the overall score, there was a statistically significant difference between the two groups of nurses with a higher median at the accredited hospital than at the non-accredited hospital. For each of the independent variables individually, the same findings held true. Looking at just nurses at the accredited hospital, there was a positive correlation between nurses' opinions of accreditation and perceptions of quality. Research question 2 asked, what is the relationship between quality improvement activities and quality of care ratings by nurses? I found a significant positive correlation between the dependent variable quality results and each of the quality improvement activities in both accredited and non-accredited hospitals. Therefore, the null hypothesis that there was no significant relationship between quality improvement activities and quality of care ratings by nurses was rejected. In the two hospitals, the highest values were for leadership commitment and support scale at 0.594 and 0.724 in the accredited and non-accredited hospitals respectively. Multiple regression analysis was carried out to test the combined effect of the quality improvement activities on the perceived quality of care and to explore the best predictors of better quality results. For accredited hospitals, the predictors of better quality results were leadership commitment and support, p-value less than 0.0001, and benefits of accreditation, p equals 0.02. For the non-accredited hospitals, the predictors of better quality results were leadership commitment and support, again at p less than 0.0001, and quality management with a p equal to 0.027. Research question 3 asked, what impact do demographic variables such as gender and age have on quality of care ratings by nurses in accredited and non-accredited hospitals? Wilcoxon rank sum tests were carried out to address this question. As shown in the table, there were no statistically significant differences among nurses' perceptions based on demographic data. So what do the findings of my survey mean? The results of my study indicated that there is a significant impact of Joint Commission International accreditation on quality of care ratings by Saudi Arabian nurses. Nurses at the accredited hospital provided significantly higher quality ratings compared to their counterparts at the non-accredited hospital. These findings support the belief that accreditation is linked to improved quality of health care. Also, the results showed a significant positive association between quality improvement activities and quality of care, and that leadership, commitment, and support are the best predictors of quality of care as perceived by nurses. These findings are consistent with the number of previous studies in which leadership was shown to play an important role in quality improvement. Finally, the results showed that demographic variables do not have a significant effect on perceptions of quality of care. This is not surprising in that the literature review showed that quality is a complex concept and its meaning and value vary among different stakeholders in the healthcare system. In summary, accreditation and other quality improvement practices are often viewed as potential solutions for improving quality in both developed and developing countries. Because the implementation of accreditation and quality improvement activities requires significant investment of resources, many researchers have called for investigation into the real value of these activities. The results of this study showed that nurses provided significantly higher agreement scores at the accredited hospital than their counterparts at the non-accredited hospital. These findings support the notion that accreditation is a good tool to improve quality of care. These are my resources. Thank you for listening to my presentation.